Hi guys, welcome back to my channel. If you're new here, I'm Dr. Abbas Ali, a full-time orthopedic surgeon, a national level faculty of orthopedics, and a part-time YouTuber. So today is a different session. This is not motivation, this is not productivity, this is nothing to do with your exams, but surely it has a lot to do with your life and many more lives that you're going to save in the future. We are going to talk about how this virus is affecting a lot of doctors over here, and especially pertaining to residents and house surgeons or interns, whatever you would want to call them. And as I was searching through the internet and the World Wide Web to find out a lot more information pertaining to these two demographies, I couldn't find a lot of information, but I was very lucky to stumble upon a handle on Instagram of someone named Dr. Gargi Kakani. And she has done a wonderful job collecting a lot of information from all these different resources, as in CDC, WHO, Ministry of Health and Family Welfare, and has collected it and presented in a very simple form for normal people like myself to understand. Although technically I'm a doctor, but I'm an orthopedic surgeon. So as you all know, orthopedic surgeons tend to forget the fine intricate details of medicine, microbiology and virology. And as I was going through her stories, it stuck to me that this is something that I should share with all of you because this is very simply presented. So here I have Dr. Gargi with me. She is a graduate from GMC Nagpur. This is a new name for me. I've never heard this name before all my life.
Oh, so interesting story. Actually, Gargi was not my first name. Thinking of a different name, but my Nanaji, who was really pious, and he said that I should be named Gargi because according to the Hindu Vedas, Gargi was the first woman to educate herself when it was not very common for women to educate themselves. So he insisted that I be named Gargi, and that is why I'm Gargi.
Oh wow, so that is a very interesting story. So I don't think I have to introduce you anymore. So we have with us Dr. Gargi Kakani, a graduate from GMC Nagpur, who is happily volunteered to participate in this discussion where we are basically trying to educate all the interns and residents regarding all the PPE and how they can protect themselves. And if, God forbid, they get infected, what are the things they should take care of? So hi Dr. Gargi, how are you?
I'm well. Thank you so much for having me, sir.
It's a pleasure to have you here on board. I was just going through your stories on Instagram and I came across a few findings where you said that although people are claiming that there are lack in PPE availability, people still don't understand what are the PPE they should use and where they should not use. I would just want you to explain what are the various components that are a part of this PPE and what are the components necessary for people exposed to positive patients, for people doing community surveillance, house surgeons, or someone like myself. I'm an orthopedic surgeon. I run the OP and IP. How should I protect myself? So if you can categorize the groups of PPE and who are the groups of people who should wear a particular type of PPE, I think that would be easy for us to understand.
Okay. So let's divide it into like three categories: inpatient, outpatient, and community surveillance. So usually if a doctor or a physician is treating somebody who is COVID-19 positive but inpatient, then they have to have the full equipment of PPE. And Ministry of Health and Family Welfare has just laid down like bare minimum guidelines that this is the bare minimum requirement that we need to have for the protection of healthcare workers.
So can you just share with us what the Ministry of Health and Family Welfare has laid down as a broad guideline for the people who are involved in treating the patients and who are just sitting in the OPD and the people who are going for community surveillance? What should they wear minimum?
So if the COVID-19 positive patient is in an ICU, and you are expecting an aerosol generating procedure, then you need to definitely have the full equipment of PPE. If you're sitting in the emergency department and you are coming across all kinds of patients, although an aerosol generating procedure may be anticipated, but you're not going to perform it in the emergency room itself, so you do not need the full equipment of PPE. You just need your N95 mask and gloves. Coming to outpatient, N95 mask and gloves. And coming to community surveillance, N95 mask and gloves.
So a bare minimum requirement is an N95 mask and gloves for everyone involved in healthcare services. Whether they are doing community surveillance, whether they are involved in the outpatient management, or whether they are involved in emergency and inpatient. And if they are directly involved in COVID positive patients' treatment, as in they are the treating physician of these patients, then they still need an N95 and a mask. But if they are going to perform a procedure where there is going to be a discharge of aerosol, then they need full PP. So can I say that endotracheal intubation is such a procedure? Tracheostomy is such a procedure, right? Accessing airway is such a procedure. Do you have any other examples of these procedures that can generate this substantial amount of aerosol that can be infective?
Even extubation.
All right.
So anything that you think that might make the patient cough is an aerosol generating procedure.
So aerosol generating procedures, so only these are the doctors who require full PPE. Now, since we've talked about full PPE, I think this is the best time for the audience to understand what are the various parts and the equipment of this PPE.
So you have a gown, you have gloves, and you have masks of two types, N95 and 3-ply. Usually they say that N95 is more effective than the 3-ply, but 3-ply is also effective.
Okay.
You have airtight goggles, a face shield, a head cover, and shoe covers.
All right. So if we don't have access to N95, we don't need to panic. A 3-ply surgical mask will be good enough. That's very reassuring, because I come from a setup which is run by the government and we usually lack resources. So this is reassuring for people who are worried about inadequate supply of PPE. They don't have to necessarily get an N95 to protect themselves. They can manage with a 3-ply surgical mask. Am I correct?
Yes, there is obviously a better protection offered by N95, but a 3-ply mask will also definitely protect you.
Right. So I think this kind of rests the problem that every student or resident or house surgeon was messaging me regarding the unavailability of the PPE, right? So we should basically understand that this is a resource and it is definitely limited and we have to ration it properly. Which brings me to the point that you mentioned yesterday, and I would want you to say that because I don't think I can say it as good as you did, regarding if you're not directly involved in the treatment of the patient, you should not utilize it or should not, waste it. So who are these people who should not unnecessarily, get into this full PPE?
Okay, that's a very, very, very good question. If you are a JR1 who is still learning, who does not know how to intubate properly, and if you're only going there to observe, please, I sincerely request you, please do not wear it. You can learn on a patient that does not require a full PPE.
That's a very valid point, because I've come across a lot of selfies, I would say, and a lot of photographs on the social media where a lot of students are just putting on these PPE to take nice photographs. I mean, I can understand why they would want to do it. It's a memorable experience for them, but now is not the time. We are at the war front here. Every PPE counts, and I think you should preserve it for people who actually need it. So now that we have understood who are the people who should wear the PPE and who are the people who should not wear the PPE, I would just like to understand, if you're supposed to wear the PPE, whether it is just an N95 mask or surgical gloves or the full dress up, how do you go about doing it step by step for the people who don't understand this?
Well, first of all, we have to begin with our basic hygiene. So keep your hair tightly, neatly tied up. This is for the head cover. Try not to have any flyaways. Then coming to the goggles, if you are wearing glasses, then make sure that the seal of the airtight glasses are perfect, or opt for a face shield. And then coming to, if you try not to have any facial hair, I know that some people have facial hair on the basis of religious grounds, but I think that this could be a really good exception, so that to make sure that the seal of the N95 mask is good and tight and it actually protects you. Then wear shirts with short sleeves so as to prevent cross-contamination. and naturally have short nails because that's where the virus hides the most. And I think that's.
So to sum it up, you said, cover your head properly so that there should be no loose hair around. Avoid facial hair if you can, and I think you forgot to mention about the makeup.
Oh, so for the makeup, if somebody is wearing makeup and that makeup tends to stick to the mask, so that makes the decontamination really difficult, and then the N95 mask has to be discarded.
So if you're in a hospital or a setup where your N95 is going to be reused or decontaminated, which we are going to talk about in a few moments, it is ideal you avoid using makeup because that makeup can catch on to that N95 and then it becomes difficult to decontaminate it. That is what you're trying to say, right?
Yes, correct.
Right. As far as facial hair goes, I have a beard here. It's like very small though, but I use N95, and when I use N95, I can actually feel the seal because when I breathe, it actually contracts, and when I exhale, it pushes out.
Yes.
So it means that the seal is intact. So if that is happening to your mask, I think you should be fine.
Yes, accurate. That's accurate.
Now, since we have already talked about decontamination of N95, can you just explain what that is, and if at all any hospital is doing it, what should be kept in mind?
So there are 3 methods of decontamination of the PPE. One is UV light, the second one is moist heat, and the third one is hydrogen peroxide vapors. And if there is any hospital that is doing this, then they should have a separate bin and they should educate their employees that these particular components of the PPE are going to be decontaminated. So please discard it in a separate bin. And say gloves are not going to be discarded, so they should be thrown away in a yellow bin. I think educating the employees in this manner would really, really help. There should be a communication between the administration and between the employees.
Right. So the hospitals that are actually decontaminating the PPE, like you said, the N95 mask particularly, they should be kept separate from the other disposable items so that they can go for decontamination. I understood. And the 3 techniques of decontamination you mentioned is hydrogen peroxide, moist heat, and UV lights. Perfect. So as an intern or a resident, I think you should just find out if your hospital is decontaminating the N95s. If they are, make it a point to not, damage them, just seal it and give it back to them. If they are not, then I think we should dispose it. Now, can you just tell what should be a proper method of donning and doffing of these PPE items?
Okay, so donning basically means putting on the PPE, and the first and foremost thing you begin with is hand hygiene, period. You cannot change the order. You have to begin with hand hygiene. And then you put on your gown, you put on your mask, and then when you put on your mask, you have to press on the bridge of the nose where the nose clip is to make sure that it molds your nose accordingly, and exhale forcefully so as to check the seal. And if you find any leaks, that's when you know that you need to readjust your mask. Also, the mask should cover your chin. It should cover your chin. So that is another thing that should be kept in mind. And then you put on either goggles or your face shield. And then you perform hand hygiene again before putting on the gloves.
So to summarize what you said, do good hand hygiene first, put on the gown, then the mask, contour it properly, make sure the seal is adequate. Put on your eye gear. Then do hand hygiene again and then put on the gloves. Is this correct, doctor?
Yes, absolutely. Bingo.
Now, what about doffing, Dr. Gargi?
So, interesting point. I had an MCQ session on my Instagram page, and while most of the doctors got donning correct, most of the doctors got doffing wrong. And I think that this is more important than donning on your PPE because this is where the cross-contamination comes from. So when you are doffing or removing your PPE, the most contaminated part of your PPE comes off first. Those are the gloves. So when you're removing the gloves, you remove the glove of one hand, turn it completely inside out and hold it in the hand that you're still wearing the gloves. and then turn this without touching the exterior of the glove. You turn it inside out like this, and don't touch the exterior of the glove and throw it in the yellow. If you at any point touch the exterior of the glove, you have to.
If you touch the exterior of the glove, you have to perform hand hygiene again.
Yes.
Got it.
And then coming to goggles and face shield. The exterior of the goggles and face shield is contaminated. Please do not remove it like this. Hold it by the rim and then remove it like how I'm showing you. And coming to the gown which is tied at the waist, pull it away from your body, and then the exterior of the gown should not touch your clothes. So remove it in such a way, put it inside out, and then discard it accordingly. And then coming to the mask, I feel that a lot of people just remove their masks like this, and I have seen this in the hospital. This, oh my God, I cannot emphasize how contaminated the exterior of the mask is. Even while removing the mask, it has to be removed with holding the strings and then removing it. I feel that doffing is more important than donning, and if every intern resident who is practicing in these COVID-19 areas must practice this.
It's funny that you mentioned about doffing, because we are practicing and we are facing this challenge every day, and we have made quite a few mistakes while doffing. And on a daily basis, I see my postgraduates making this gross mistake of constantly touching their mask and bringing it down and back up, which is baffling because they are touching what is the probably a very contaminated part of PPE, and they are moving as if nothing happened. And by mistake, if they bring their hand back to their face, they have successfully infected themselves.
Absolutely. Oh my God, this should be a crime. Touching your mask and then touching your face or other things should be a crime for doctors. It's what gives rise to cross-contamination. Because then imagine if you're touching your mask and then you touch your pen and then you touch your eye. It's everywhere, and then you give that pen to a friend. Oh my God, it's everywhere.
So what do you suggest we do? Can you give us a routine example of a day in a life of a doctor who's involved in treating COVID positive patients or in surveillance or something like that? How would they go about? You have talked about donning and doffing. I would just want to know what are the routine mistakes that they make and they can avoid if they know about this.
Okay, so your daily routine should be something like you are in your car or in a public transport, you're going to your hospital, and then at the hospital wear absolutely bare minimum of clothing that you require. Please avoid wearing watches or unnecessary jewelry or anything that you feel you might not require over there. That is point number one. Then when you actually don the PPE, I have already explained the procedure, and then doffing I have explained. But then after doffing, one most important point is that perform hand hygiene. And if your hands are visibly soiled, then wash your hands, because the 60% hand sanitizer is not going to. When you are going back home, I would recommend do not touch the door of your house. Instead, you can maybe call your roommate or your family member, whoever you're staying with, and they can open the door for you. Leave your shoes outside, not anything, and straight go take a shower and put your clothes in the laundry, in the washer, and run a cycle. Just your clothes, and that's it. If you're carrying your tiffin with you, please wash your tiffin immediately. And I'll tell you the reason in a couple of minutes.
Now that you have mentioned about the tiffin box and the items that you carry to the hospital and bring back home, my question to you is, how long do you think the virus, or how long does the virus survive on these surfaces so that we can be careful?
Okay, so this is a very, very good question, and this could explain a lot of the cross-contamination that doctors come across. So there was a research done and published by New England Journal of Medicine, and they said that the virus remains viable in aerosol for up to 3 hours. But when I say aerosol, it does not mean air, because a lot of the media in it misunderstood and misquoted them, saying the virus remains viable in air.
Yeah, so there was a day when I was scared to go out because I read the headlines in the newspaper saying that now it is found that the virus is airborne.
You know, media is doing it for the clickbait, but at least medical doctors, medical professionals should not fall prey to this and should read more than the headlines. So I think this point, even in my peer circle, it got recirculated a lot, and everyone was like, "Oh my God, 3 hours in air, that is so scary," and it is really scary. But that I also have to mention that when this experiment was done, they had used some very, very powerful machines, and normal human cough does not look like that.
So you mean to say that tests were conducted in an environment where this machine was generating aerosol that was much more in volume and power compared to a normal human being's cough or sneeze or whatnot, right?
Yes, absolutely. In fact, WHO even released a statement saying that this is not what a normal human cough looks like.
So we should not be worried about it flying in the air and then we catching it.
No, absolutely not. So there are no airborne precautions, but there are contact and droplet precautions. And the difference between these two is that respiratory droplets are 5 to 10 microns and droplet nuclei are less than 5 micron, and therefore droplet nuclei जब होते हैं तो वो airborne transmission माना जाता है, but this is not droplet.
So for an orthopedic surgeon who doesn't understand that mumbo jumbo, can you just tell me whether I will contract SARS-CoV-2 if someone sneezes in the next room or the next floor or in the next building, or?
Absolutely not.
All right. So that's reassuring, because nowadays when you go out or you go to the hospital, if somebody coughs, everyone just gives him this dead stares like, what the, right? So I should not be worried.
Not at all, not at all.
So what should be the standard distance that I should keep or people should keep between each other? Because there's a lot of conflicting information coming out. Some people say 6 feet, some say 1 meter, some people say 6 meter. So can you just put some light on this?
Okay, so this is, we should follow the metric system, and it is 2 meters. Forget about everything else. 2 meters is equal to 6 feet. But it kind of gets interchanged and people often misunderstand, and 6 feet somehow becomes 6 meters. That is not. 2 meters.
And we as Indians are not very familiar with 6 feet. Although we know कि बच्चा लंबा है मतलब 6 feet है, but horizontally we don't have any idea of how 6 feet translates into. So can you just give a simpler expression? I mean, can we say an arm's length?
Oh, definitely. An arm's length would be like 1 meter. So 2 arms length would be 2 meters.
All right, excellent. So stay away from people just with 2 arms length would be fine. And I think people, if they learn the whole coughing etiquette and all, I think that should be fine, and we should not panic about it flying around in the air. And
no, absolutely.
What about the other surfaces?
So coming to cardboard boxes, it stays viable on cardboard boxes for up to 24 hours. And so you know what has cardboard boxes?
I don't.
Pizza boxes.
Pizza boxes. That's insane. So let's stop ordering pizza, people. All right. That's what you're saying.
Yeah. Yes.
Right.
Yes.
And even if you do order it, clean it.
Yes. Did you read the news in Delhi where a pizza delivery boy was infected, and then 72 people are now under home quarantine because he was infected and he was delivering these boxes?
So just because you're getting your food delivered by a brand or a company doesn't mean that it is sterilized and secure. After all, these are human beings who are getting it to your door. Make sure you clean the surfaces and then you consume. Ideally, you should heat them before you consume them as well, right?
Yes.
So anything more that you want to add regarding the virus staying on the surfaces?
Yes, oh, absolutely. So when I was speaking about different boxes, and the reason is because the virus remains viable on stainless steel up to 72 hours. And this means that anything in our house that has stainless steel, including tiffin boxes, including the tap from our sink, including everything and anything that even elevator buttons, they are stainless steel in some scenarios. So if the virus remains viable for 72 hours, can you imagine the number of people that it would infect? Although the viral load, there is an exponential decrease in the viral load, but it's still 72 hours. So I think that, and another thing is that even on plastic, it remains viable for up to 72 hours. And you know what has plastic, sir? Pens. Oh my God.
The ones we carry around in the OPD and the OT and everywhere.
Yes.
So these harmless little pens are actually weapons of mass destruction.
Yes. Oh my goodness. So if you are using a pen in the isolation ward, please do not bring that pen outside. It's okay, हम बाहर से नया pen खरीद लेंगे. Please do not chew on your pen. Please do not think with your pen. Don't put your pen anywhere in the vicinity of your.
Right, so it's good that you've mentioned about pens. So once we are talking about pens and all these surfaces, I think we can talk about stethoscopes. We can talk about everything else, BP apparatus. We can talk about all the items that a doctor uses to clinically examine a patient or see a patient. What do you suggest we do about this then?
Okay, so we have to use like sterilized cotton and use sterilium or any sanitizer with 60% alcohol, and clean the diaphragm, the bell, even the tubing up to the earpieces. Clean the entire stethoscope, your thermometer, even say the BP apparatus. I mean, it's the rubber cuff and everything can be left out. But like the stainless steel cover or whatever kind of apparatus that you might have, if it's plastic, then please clean that as well.
So you suggest taking a sterile piece of cotton, dabbing it with the spirit or the sterilium or a sanitizer that is available, and then wiping everything that we need to carry around. That includes obviously the spectacles, the stethoscopes, the thermometers, the knee hammers, and whatever you need to carry with you. They should be wiped before you go home. And ideally, I suggest leaving all these things there in the hospital itself, and don't try to take them back, because I don't think people would want to take anything at this moment from anyone.
Yeah, absolutely.
No, God forbid, Dr. Gargi, God forbid. I really don't wish for any doctor to, go through this, but God forbid, you feel that you have been exposed by the virus. Now, my first question is, what kind of scenarios should make you believe that you are at the risk of exposure or you have probably been infected?
Well, if you have been in contact in direct patient care of somebody who is tested positive for COVID-19 and you're not wearing PPE, you're not wearing N95, you're not wearing gloves, and you've been touching your face. So if you're in a contact of a positive patient and you're not protected by the required PPE, then you are at a risk of exposure. Right? Any other scenario? Yes. So if you're sitting in the OP or the emergency department and you don't have your mask and gloves and you come across a patient that was tested positive, then you could be at a risk of infection. If you're going for community surveillance and you don't have a mask, you don't have a pair of gloves, then you could be potentially infected.
No. My question is, suppose you come across a patient and you have, examined them and seen them, and you have discharged them, and you never know whether this patient was, infective at that period of time. But because you were not wearing a mask and glove when you were examining him in this lockdown period, would you consider yourself as an exposed individual, or should you not worry about it?
I think that if the patient has tested positive later, even if at that point of time he did not have symptoms, at this point we don't have enough studies that actually explain the transmission in asymptomatic individuals. So we just have to assume that you have been infected, and then you start taking your measures, your protective measures, quarantine for 14 days, and just clean up everything.
Now, let me make this broad statement and tell me if I am correct or not. Okay. If you're sitting in the OPD, or if you're going for a community surveillance, or if you're treating a patient, and if you don't have the bare minimum, that is N95 and surgical gloves, are you at a risk of exposure?
Yes.
So that is, I think, the summary of the people who can be assumed to be at the risk of exposure. So my advice to all of you is that when you go to the hospital, make sure that you protect yourself. And the bare minimum is surgical gloves and a surgical mask. Ideal surgical gloves and an N95 mask. And if you don't have either of those and you are exposed to any patient, you are at a risk of exposure. Am I correct, doctor?
Absolutely. Very well said.
Thank you. Now that we have talked about people who are at the risk of exposure, now God forbid, if someone is actually exposed or who's been through the scenarios that we have just talked about, what kind of post-exposure management can we look at? I mean, the first problem I can assume is he would ask this question, why me? And he would be depressed, disheartened and broken. Because he is a healthcare worker, he's at the front line, he's defending everyone from this problem, and this problem has, affected him. What are these challenges, and what are the things that he should follow after this problem?
I think first and foremost, there should be no guilt. There should not be any thoughts of why me. I feel that at this point, your mental health is as important as your physical health, and I know it's very easy to say, and I don't want to sound preachy, but don't break down. If there's something that is bothering you, if you want to talk to someone, find a friend and confide in them.
I think it is safe to say that both of us talking here right now had a scare of exposure, and both of us have actually put ourselves in quarantine, and we have lived those 14 days. And I think we can tell you this, that it is painful, it is scary, it is difficult, but you can overcome that. And I think I want to hear your story, Dr. Gargi, because you've been traveling and you came from US. And
yes,
you had a lot of resources to basically get back into your home without any problem, but you still tried to protect your family and did not want to contaminate anyone in the country. And what are the precautions you took, and how did it feel?
It was difficult because normally when we come back home from anywhere, we are welcomed with hugs and kisses, and that was not the case this time. It was, stay in your room and eat your food in your room and clean down everything that hands touch at least twice a day with Lysol and water. It was painful, and I was literally counting down the days to when I can finally hug my parents, when I can finally sleep in my mom's lap. I think, that was very difficult.
So I think that was the story, and that was the feeling and the emotion behind her passion to learn more about this SARS-CoV-2 and COVID-19, and that reflected in her stories, and that's how we found out about her. And it was a very vulnerable moment for me as well, because I was at a risk of exposure because I took a few flights at that time, and I didn't want to get back home to my child, and so I had to move away from him. So it was this 14-15 days where I was away from my child, and it was heartening, and I could relate to the feeling. And that is when I found out about her, and that's when we started discussing all these things, and now we are here to share all these things that we learned with all of you.
I would call it serendipity. A happy accident.
So now that we have talked about this post-exposure, right? So if you're exposed, the first feeling is the feeling of guilt, and why me? And now I'm sure that looking at the example of us too, you can overcome that feeling. But what next? What should you do now?
So the first thing that you should do is clean up everything that hands touch, surfaces, railings, the lock of your door, elevator buttons if you touch. And clean up everything, every single thing, pens included. Clean up everything with 10% Lysol and water. Practice hand hygiene, practice respiratory hygiene, and try to maintain a distance of 2 meters from all your loved ones. I know that it may be difficult if you're living in a hostel with roommates, but if you can, please practice social distancing. 2 meters is important. Don't worry. We will get through this.
So how long do you think we need to do this?
14 days.
14 days. So 14 days is the quarantine period. If you feel that you have been exposed, what if you have symptoms?
If you have symptoms, then you must report to the authorities. There are many national helpline numbers, or if you're a healthcare worker and you can directly reach out to the hospital administration, you can definitely get tested. If that test comes back either way, then I think prepare your mind and be mentally strong to accept that it is positive and that you will get this.
We will definitely leave down all the numbers in the description, and everything that we've talked about, we'll leave on the scientific information and data and the studies in the description. So if you want to get into the detailed discussion of those things, you can definitely read them and write in the comments. Either of us will definitely reply. Now, my question to you is regarding doctors or interns or medical officers working in PHCs and district hospitals. What should they do when they suspect a patient of COVID-19?
If you are suspecting a patient of COVID-19 or of any respiratory symptoms, make sure that all the beds of your PHC are one meter apart as per the guidelines of Ministry of Health and Family Welfare. If you have enough room for 2 meters, then well and good. Counsel the patient, and if you suspect that he or she may be definitely positive and you need to transport the patient, then there are certain training modules that I have found out, that I have come across, and I'll ask sir to link them down below. So get yourself acquainted with this information as to how you are supposed to go about it. Also, isolate these patients away from the other patients that you're treating. Keep them in a separate room, or at least like 1 bed apart. That's the bare minimum.
All right. So this was the session that we planned to basically educate all the residents and house surgeons, because these were the people who were reaching out to me asking for specific guidance regarding the management of either COVID-19 patients or risk of exposure and how to protect themselves from all of these problems. We have more content to talk about, but it depends on how you react to this piece of information that we are putting out there. I've gotten a lot of questions regarding the treatment, the use of ivermectin, hydroxychloroquine, and various other antivirals. I've also been asked about the plasma treatment, and I'm sure Dr. Gargi would also want to share a lot of insights, because she has a network of doctors who are in contact with the people who are doing a lot of research abroad. And we would want to bring all of this information to you only if you really want it. But these were the fundamental questions that you were asking me on the social media and my Facebook and Instagram handles. You were asking regarding the PPE, whether you should be allotted a full PPE or not. You were asking about the surgical masks and N95, and you were asking about the cleaning of the surfaces, the equipment, and how should a daily routine be. And I think we have talked about all these things, right, Dr. Gargi?
Absolutely. So you've done a wonderful job.
No, you have done a wonderful job because you have explained it from the technical aspect, which I was lacking, and I had no idea that there was so much depth in this information, because I am an orthopedic surgeon and I don't have, number one, the time, and number two, the energy to go through this vast information. And you have done that. And once you go into the description, you will see all these articles, and she has read all of that. So I would just like to thank you for being a part of this right now. And I would definitely want to engage you in the future if the audience seeks more information regarding COVID-19 and SARS-CoV-2. Will you participate?
Oh, of course, without a question, sir.
So this I have documented in video now, so everybody knows that she will participate. So I would like to thank all of you who have asked for this kind of video from us. We have never done this before. This used to be a productivity and exam strategy channel, but we have done this because all my students who have appeared for these exams are now either interns or residents in these hospitals, and they need to take care of themselves. I wish you guys all the best. Do take care of yourself and protect yourself, because you guys are the real soldiers. Thank you, Dr. Gargi, for being here. Take care.
Thank you so much for having me. Bye, everyone. Take care.